Management of cough in children. Cough is a common problem, and by far the commonest cause of cough is your allergic rhinitis and upper respiratory infection. Allergic rhinitis is where you have rhinorrhea, sneezing, and seasonal or perennial throughout the years, maybe in the winter. So these children have postnasal drip. When the secretion trickles into the posterior pharyngeal wall, you have postnasal drip and a little bit cough something. So they are clinically obvious. They do not have any throat finding. They do not have any fast breathing. So and in nose they do not have nothing any finding. So explain the parents what you are diagnosing and how do you treat. You can give intranasal steroids, you know, uh, 2 to 3 times daily as it is needed, so long it is symptomatic. Without symptom, don't give anything. You can give Montelukast little bit antihistamine, but they may not be given also. The outcome is not that different. Nasal, intranasal steroid spray or um, when there is throat infection, pharyngitis, adenotonsillitis, you have cough in the throat. The mother says, "Look, my daughter, she is having cough from the throat, and this child do not breathe faster, and they do not have any wheeze or crepitation." So your diagnosis is in those cases throat infection. So give one antibiotic if you need, and in viral cases, 2 to 3 days, you do not need to give any antibiotic. When you have fast breathing, they have diagnosis of pneumonia. By far the worst one. See those cases, and you give oral antibiotic if it's breathing criteria. Diagnosis simple pneumonia. If your diagnosis is severe pneumonia, breathing criteria more than 60 in 2 months, up to 2 months to 2 years, 50 and above, to 1 year to 5 years, it is 40, and adolescents and adult it is 30. So if it is the case, you give IV antibiotic. Then if there is who is a recurrent sort of the lower respiratory involvement, nocturnal cough, and you was it relieved with bronchodilator is asthma, you give bronchodilator. And your times you need to give the rescue prednisolone 2 to 5 days, 1 to 2 milligram per kg. You should give asthma preventers. The Montelukast, weaker one, stronger one is the inhaled or nebulized corticosteroid. Give it for 3 months, 6 months, 9 months, and taper gradually. And when the disease is off, recur, give again. So, long-standing cough, you have tuberculosis, bronchiectasis, lung abscess, interstitial lung disease, plenty of other diseases are there, Cartagena syndrome, into your congenital immunodeficiency and so forth. They are not that common, but possible. So, not improved with the above treatment, you go for the investigating those cases. Cough may be due to the heart cause, the left ventricular failure, congestive cardiac failure. You will get murmur in those cases. You will get the tachycardia gallop. You will get the orthopnea. And in CCF, you will get the tender hepatomegaly, raised JBP, better seen above 2 years, and pedal edema. They are rare but possible. So look at those things, and take measures. Diuretics, maybe digitalis, oxygen supplementation, and other supportive cares. So habit cough, tics is also not very uncommon. So explain the parents the when there is anxiety, the child is having a little bit of cough, and there's it's a little bit of they are worrisome, embarrassing for the patient. So and severe dyspnea, cough with severe dyspnea, danger signs, cyanosis, your lethargy, convulsion, unable to feed or drink. Those cases need to be referred to a hospital. So see those things, and antihistamine and variety of cough remedies. They are absolutely useless. Nowhere in the text and literature throughout the globe in the Western don't find any use of those things. They have also plenty in their market, so they are not useful. Antihistamine is potentially useless. It sedates the child and makes the child drowsy throughout the day and night, and is without any benefit. In asthma, it gets worse with antihistamine. And apart from that, you have bacterial tracheitis, croup or acute laryngotracheal bronchitis, acute epiglottitis, which is a condition where you should not attend further multiple examination and referral to OT and anesthesia where is needed. So they have totally, they have, those children have, at times danger signs. So they have referred to ENT people, and an ICU facility might be needed in worst possible cases. So these are the ways that you will evaluate the and treat the cough in children.